ALL, acute lymphoblastic leukemia. Most common with kids.
The only thing I remember, she told me your baby might have leukemia. And since I knew what leukemia was, I was numb. I couldn't say anything. I didn't know how to react. I didn't know whether to shout or to cry or to laugh.
It is February 15th, 2020. Maybe just a normal day, but globally, today marks International Childhood Cancer Awareness Day. The aim is to raise awareness and express support for children and adolescents with cancer, survivors, and their families.
Cancer, at the mention of its name, gives you memories that you may not want to look back to or a space too uncomfortable to be in. It affects people of all ages, including children, and has been labeled childhood cancer.
According to World Health Organization, each year, approximately 300,000 children are diagnosed with cancer globally. The Kenya Demographic Survey states that the most common type of cancer in children is lymphoma, a cancer that begins in infection-fighting cells of the immune system. The Kenyatta National Hospital has a pediatric cancer unit where, according to the Kenya Cancer Network, childhood cancer accounted for 15% of cancer admissions at KNH between 1998 and 2008. So what is the situation like so far in Kenya?
The story of childhood cancer in Kenya is still not a good story to tell, because while we compare, we say that 80% of children with cancer all over the world are found in low and middle income countries. That means actually a lot of the children with cancer are our children. But you notice of the 20% who are in high income countries, 80% on average, some cancers even 98% will actually survive their cancer diagnosis. But in Africa, in low-income countries, in Kenya, we are talking about less than 20% survival. So that is actually something that is very, very alarming. And I keep telling most of people that we can treat or cure childhood cancer, but we need to have a lot of systems working, from starting all the way from early diagnosis and detection of cancer to the diagnostic facilities that can be able to give us exactly what type of cancer this child has, investing in treatment, and then how to follow them up. And this can be done. It has been done in other parts of the world, and for sure we can do it in Africa, but it requires a lot of effort and requires a lot of systems to work together so that we can improve the story of children with cancer in Kenya.
Common cancers in children include leukemia, bone cancer, brain cancer, eye cancer, among many others. But childhood cancer is curable.
A lot of the children we see children with acute leukemia, and there are two types of leukemias, mainly two major types. We have one called acute lymphoblastic leukemia, and those form like the big bulk of the leukemias we see. Then we also have what we call the acute myeloid leukemia. They're not as common, but we have a few of them in children with cancer. Then we have the lymphomas. And this is something that we see in Africa and also in certain parts of Africa. And we are in that belt that we see a lot of children with lymphomas. And the lymphomas are also in two big groups. We have the ones we call non-Hodgkin's lymphoma, and then the Hodgkin's lymphoma. And of the non-Hodgkin's lymphoma, we have one specific one called Burkitt's lymphoma that was actually discovered just right across, I think, the western part of Kenya and Uganda. And that's where it was really, they found most of the patients were coming from. And then from there we have our brain tumors. And what is interesting is that in Africa and also in Kenya as a whole, we don't see as many brain tumors. And the rest of the world, wherever you are, whether it's Asia, whether it's Europe or in the US, we see a lot of children with brain tumors. but in Africa we don't seem to have. But our gut feeling tells us it's because we are missing them, having missed a lot of misdiagnoses. Then from brain tumors we also have something we call the eye cancer. It's called retinoblastoma, and then also more commoner cancer is actually, or one of the kidneys, we call it Wilms tumor.
We go back, we get admitted, but now the results zinasoma mtoi akona platelets za 4, and there's supposed to be a minimum of 150. Na akona 4.
And he was diagnosed with?
ALL, acute lymphoblastic leukemia. Most common with kids.
The only thing I remember, she told me your baby might have leukemia. And since I knew what leukemia was, I was numb. I couldn't say anything. I didn't know how to react. I didn't know whether to shout or to cry or to laugh.
When the body is feeling sick, the symptoms help to get a diagnosis of what the body is ailing from. Cancer in adults is different because it is linked to lifestyle, but for children, it is not the same.
Adults, we sort of insist that they should go for screening, early screening. But for childhood cancer, there's really not much value in screening. And this is because a lot of childhood cancer is not related to lifestyle. Because most parents, when they have their child diagnosed with cancer, the first question they ask is, what did we do wrong? And I say, there's not much we know. That is, there are very few risk factors we have that will predispose your child to having cancer. So what they need to have, and what caregivers, parents, healthcare providers, we need to arm ourselves, is looking at these symptoms that are almost similar to other common childhood illnesses and saying, I think they have persisted for too long.
Obert was a bit homa, on and off, but we never thought, we always thought that these are the things that kids go through as they grow. So we really didn't give them that much thought. So officially, tunaweza sema we started the journey in February 3rd. That is when I took him to hospital with the paleness. That was the only thing that made me rush to the hospital.
He was having fever, but he had been having a cough for around like a month. But you know, for a child who is going to school, huwezi ona kama cough ni big deal. So I was waiting for Saturday after work, then I can take him to Hosi.
8 out of 10 children get cured in the high-income countries, while 2 out of 10 children from middle and low-income countries are healed. With access to quality care, more than 80% of children with cancer can survive, live fully, and healthy lives. So the government and the community has a role to play.
Just to start off with a huge disclaimer that childhood cancer is curable, but we must be able to detect it early. And we have 3 big modes or modalities that we use for treatment. And one is using medication, and that is what we commonly use to treat childhood cancer. And this we call chemotherapy. And chemotherapy just means drugs that we use to fight the cancer cells. But even as they fight the cancer cells, they also sometimes will affect the normal cells. But we expect that the doses that we are giving, that basically they should be able to cure, and the normal cells will come back once the cancer cells are finished. Then the other big modality we use is surgery. So it comes in that sometimes we need to make a diagnosis, so we need to have a biopsy done, or we need to have the cancer itself, or the tumor we call it, removed, and that's where the surgeons come in. We have the cardiothoracic, we have the orthopedic, we have the pediatric surgeons. Then the other mode we use is actually called radiotherapy. And radiotherapy just means using special X-rays that, given us a certain dose and intensity, are able to kill the bad cells. And this is one modality we use in combination with our drugs, with our surgery, and then we add on so that we maximize on how much we are able to kill and hopefully cure the child of cancer.
Daktari alituadvise you'll have to start chemotherapy immediately. Na hizo chemo ziko in stages. It started with the first phase. Then the first phase was not so bad. And now the second phase was really hard on him. He lost weight. He was 22 kilograms when he was 30. By the end of that phase, he was 19. Hata kwa kuvaa trouser hakukuwa ameisha. Therefore, ika-affect miguu, mpaka kutembea ilikuwa ni shida. But throughout tumekuwa tu on chemotherapy.
So one of the biggest issues that we want is working with the communities, and this is something we also realized, because we as healthcare providers, we work in hospitals, but people live in the communities. So having that awareness also in general in the community, and also with people we call community health workers or community health volunteers. One way you can is being your brother's keeper. When you notice that their children are having certain specific symptoms, and you could be aware these are signs and symptoms of childhood cancer, please encourage them to be able to seek healthcare earlier so that we can be able to detect. Then the other thing is, even when we treat children with cancer and also their families, is we take them back to the community. And a lot of the time we find a lot of stigma. People will think, oh, maybe these people are cursed, or maybe there's something they did wrong, or and sometimes parents and families with cancer feel very isolated. They don't know what to do. But we appeal to the government in general to actually find it that it's cost effective, and it's so cost effective to treat children with cancer, to invest in treating children with cancer, because children are our future, and these children can survive. They can survive and be able to do lots of things for this wonderful nation.
That thing is expensive, I'll tell you that much. It is very, very, very expensive. It will drain you to the last coin. Especially when he was on HDU, the bills were going up very fast. Mpaka tunajiuliza kama tutamtoa hospitali. And now friends and family came. They told us you should not worry about anything. What's important here is that we are going to save the life of Travis. So they joined, they wakakusanya, they started a WhatsApp group. They prepared a harambe. We rely on well-wishers, family, relatives, friends. Kuna packages za chemo nowadays, at least tume advance kidogo.
The theme for this year is I can and I will. Therefore there is hope, because childhood cancer is curable.
He's now a young man, he's grown, he's not a baby anymore. Like we completed our frontline back in 2017. So from 2017, we were on long-term maintenance, which is oral chemo and lumbar puncture after every 3 months. So that one, we went through it, trans for like 2 years. We went through that, we finished that phase, that usually is the last one. So currently, tuko tu without, we are not on any medication. We are there. Thank God it has been a journey.
Right now he's doing very well. Currently he has even gained his 25 kilograms. He's back to himself. He has no pain. Because the worst thing for a parent is to see your child in pain. But at least right now he's not in pain. His life is like back to normal. Just like he just can't go back to school, but otherwise,
a message just to the parents who have the kids that we've just been recently diagnosed. We just need to follow the protocol, follow what the doctor says, we maintain a diet, a nice one, healthy for that matter.
Be prayerful and be strong for your baby. Because our babies, they lean on us. Ukimwonyesha stress, ukimwonyesha you're sick, atakuwa sick even more. But ukimwonyesha everything is okay, he is going to fight. He or she is going to fight.
And all is well. All will be well. There is nothing that God cannot do.